Hi, my name is Navin Verghese. I'm a Consultant Spinal Surgeon. I work here in Sancta Maria Hospital, dealing with all aspects of adult spinal surgery, from the routine procedures and problems through to more complex redo surgeries, revisionals and minimally invasive surgery, which is my specialist interest. As part of the aging process, the spine can develop increased bony spurs, thickened ligament and bulging discs. On the whole, this doesn't cause an issue. And it's part of the natural process. However, in some patients, this can cause pressure on the nerves and what results in lumbar spinal stenosis. Generally, lumbar spinal stenosis presents with what we term neurogenic claudication. This is the manifestation of the pressure on the nerves, which then causes pain in the back, classically into the buttocks, the back of the legs, sometimes down as far as the feet. The classic lumbar spinal stenosis causes pain when you walk, and these symptoms when you walk, but it's usually alleviated by leaning forward or sitting down. The typical patient who comes to my clinic room will basically state that they have the pain as soon as they stand up, but is alleviated by leaning forward on a shopping trolley, for example, or if they lean forward or bend over to tie their shoelaces. For those patients who develop lumbar stenosis symptoms and it's causing significant debilitation of their day-to-day life and in particular their walking distance, we can offer surgery. In fact, surgery is the gold standard treatment for this. Dependent on where your stenosis is, will depend on the type of procedure you have. However, most patients would benefit from a lumbar laminectomy or a decompression. This is, again, a fairly straightforward 1-hour operation for a single level surgery involving removing sections of bone, ligament and sometimes the bulging discs which are pressing on the nerve. It's a general anesthetic procedure and usually an overnight, sometimes 2-night stay in hospital. Aside from the generic risks of surgery, such as anaesthetic complications, bleeding, blood clots and infection, which are all fairly reassuringly low, there are specific risks for spinal surgery. In particular, what everyone is understandably concerned about is the risk of nerve damage. For this type of procedure, for a standard laminectomy, for example, the risk for this is reassuringly low, approximately 1 in 1,000. There are more common specific risks, such as spinal fluid leak. That can range from between 1 in 5 to 1 in 20, depending on the degree of stenosis, and if it's a redo, for example, the risks are higher. This, however, is generally safely managed on flat bed rest for a couple of days and may delay your discharge, but on the whole, it's very unlikely to affect your long-term outcome. Because of the nature of the incision, which is basically a cut in your back, you can experience moderate back pain post-operatively. This can be usually well managed with simple painkillers, and most patients are home within 1 to 2 days following this surgery. However, that is offset by the fact that most patients enjoy significant improvement in their leg symptoms almost immediately following the surgery. And certainly by the 6-week stage, most patients come back to outpatient clinic with significant improvement in their walking distance, and their back pain has returned back to its normal baseline levels. Depending on the type of your spinal stenosis may dictate what type of operation you have. Most patients have a laminectomy, but if your spinal stenosis is an association with instability or a spinal deformity or collapse, then you may be offered by your surgeon a lumbar fusion. In Sancta Maria, we have access and the ability to perform all types of fusion, including minimally invasive fusion techniques, which can significantly improve your surgical outcomes.